Hey everybody, it's Matt, Dyan, okay, Aussie. It is Monday, 28th, 5:32. Dyan's just had seizures, as you can see from the heart and oxygen monitor. We've had massive oxygen drops down into the very low 80s. We've had a bit of a heart rate drop. She's then just gone into tonic-clonic seizure. I've just put her flat and had her temporarily in a recovery position. She's got blepharism and facial dystonia at the moment happening. We're just going to monitor her in position. You're okay, boo. You're doing okay. Let's keep an eye on what's happening. She's had a couple of hours like this. We were waiting on the cusp of seizures previously. Diane's already had her evening medication, so she's just had only 15 minutes ago clonazepam 2 milligrams. They're beautiful. It's okay. You're doing okay. She's also had a sodium valproate, so that's some normal nighttime medications. About an hour ago I gave her some medicinal CBD, THC 1010. We were having oxygen drops at that time as well. Start of this was a heart rate drop down to about 46. Seizures still going on. So. $5.34. Supplementary oxygen supplied. Dystonia in the left hand. Inversion of the left foot midline. Facial segmented cranial dystonia. Oxygen is currently at 94%. Heart rate's at 56. Dyan's BSL just prior to this was at 5.0. External temperature is 22. Internal room temperature is 24.8. Tonic-clonic seizure, 5:33. It's Temperature's really dropped off, which is good. She was previously 37.4, 35.5 according to this. So we've previously given her some Panadol to reduce the temperature. Oxygen stats at 97, heart rate's at 56. That's okay. If you want to dribble up, that's okay. Yeah, really gorgeous girl. Dystonia in the left hand. Some focalized multifocal dystonia. Nothing in the foot, it's only upper region of dystonia. Oxygen stats are good at 97. Feel a bit in your nose. It's okay. Oh yeah. We're expecting this, high probability. Diane's had very poor sleep quality. She's had about 4 hours sleep, unable to get to sleep until 2 AM, awoke at 6. High levels of stress. Increase in bowel medications for her GI, gastroparesis. Syncope, 5:35. Come back. Yeah, doesn't manage on your back. Here we go. Dian's had a lot of pain. She woke with migraines. She's had some rizatriptan wafer, a quarter of a wafer earlier this morning. Pain had been quite high for her. She was just off febrile temperature. Hello, sweetie. That's heart rate dropping out. If you have any chest pain, just let me know by touching your chest. Heart rate drops. Oxygen's... It's okay. It's okay. 5:37. Hey, gorgeous. It's okay. We're going to try that again. Without a tonic seizure halfway through, eh? Let's try that again. Okay. Resetting. Because she's had the clonazepam for the night medication, that's very good timing as a muscle relaxant for the dystonia that she's going through at the moment. A lot of the typical segmented cranial dystonia, blepharism at the moment, oral mandible, jaw thrusts. Her blood pressure is 110/74, heart rate is 58. That's high for Dyan. Remember, her baseline is 80/65. Gorgeous. Can't get a break on these, can we? Having a lot of oxygen drops today. So as you can see in these sort of behaviours, we're getting them down to 85 regularly, hence why we've got the supplemental oxygen going at the moment. Heart rate's just starting to flap a bit as well, so that's why we have the alarms going off for low oxygenisation. Sorry, low heart rate. Hello, baby. Hello. Hello, sweet thing. Too much stress. Okay? No one's been giving you a break on the stress side of things. We're dealing with multiple stresses at the moment. NDS failure with the change of circumstances, which is where we're missing out on having any supports. There are no support staff available to Dyan currently. She has totally utilised her entire budget for the NDS at the moment. So because that has done, we have done a change of circumstances in January, 28th of January in fact, with support from the hospital on the 7th of February. And all that's been lost by the NDS. So there was no active change of circumstances. We're getting some distortion in the left foot, so left side tight paroxysm with dystonia of focal, jaw opening and closing. Don't know if you can see much of that from that distance. You can see the hand position, you can see the foot position. This is what the face is doing. We do these video recordings for the clinical team, hopefully to help and give guidance and support from neurology. Dyan's under 22 odd plus different specialists, ologists at the hospital. She has a chromosomal genetic condition, 22q, microdeletion, where she is missing anywhere between 30 to 50 genes, 3 million DNA. Indications of pain, right quadrant, left quadrant, back. Okay, I'm feeling muscle fibrillations on the right hand side, left hand side, coming up from the gluteus maximus. It's alright. Just gonna put some pressure there. I'd say these are dystonic contractions. We're getting upper twitches. You can see the twitches that are happening. It's 5:41 p.m. Okay, we don't want the arm through there, can you? Oh, that right shoulder was dislocated, is it? It just popped in. Okay, she's in. Dyan's hypermobile, ehlers. She can very easily sublocate or fully dislocate. So subluxations are quite common, especially with anterior dislocation of the glenohumeral. Come over here. Let's get you breathing a little bit better. You're having problems with your ability to release. Come on. It's okay. Hey, baby. We're getting full body contraction. Still 541. Come on. Otherwise, I'm going to have to give you some Medaz. Sorry, you're doing really well. Come on. Don't worry, it for me. Heart is at 58, oxygen's at 97, supported obviously with supplementary oxygen, luckily. Heart rate drop. Cycling on the legs, thrashing is part of the chlorea. That's part of generalized dystonia for Dyan. So it's a full body action. It's almost like a dancing, sliding movement. That's why it comes from the word choreography. Greek word for dance. Hey, gorgeous. Just feeling for any tension. So no focalized dystonia in the feet. Still getting jaw activity. Yeah, I'm going to. Rigidity in the toes coming through midline first, secondaries. It's 544. It's okay. It's okay. It's alright. It's alright. More tonic-clonic seizures, 554. Come back. Come back. Come back. It's okay. Gotcha. Providing 5 mils, midazolam buccal, just down the jawline. Current time, 5:45. Good. Hey Google, set timer, 10 minutes.
Okay, starting now.
Oxygen saturation 97, heart rate at 66. Emergency ASM. Midazolam 5 milligrams has been applied. Good, get on. Right eye is mostly closed, left eye is almost fully open. We've got an imbalance between the eyes with the blepharism. Heart rate drops on the monitor alerts. Expecting pain. You can see the facial muscles that are working here. So, we've got an axial, which is in the forward plane of the neck dystonia, so it's actual neckline moving the whole head forward. So if it's not an axial tilt to the side but a forward axial thrust, you've got blepharism, eye issues, jaw, mandible, bit of jaw thrusting with the tongue as well. Simultaneously, you can see the hand in its postural position. This is a segmented dystonia. Feet, nothing's to be seen. It's going to pass medication that I've given you. It's going to kick in very shortly. I've set a 10-minute timer just to see how we get a response within the time frame that I expect for midazolam. Obviously I'm monitoring her ability to swallow, particularly with dystonia if it's affecting diaphragms, intercostals, esophagus, ability to swallow. She's already got issues with swallowing with dysphagia. She's had aphasia, which is speech and other related cognitive issues as well, and her motor sense lately. Issues with ataxic and aphasic walking gait. Part of the issues pre-ictal commonly seen. Hasn't been any nausea, but she hasn't been able to eat much. So she's had no ondansetron this round through because she just hasn't been eating today at all. Again, the legs are going with the whole core. This is that thrashing and cycling action that's moving through. The dystonia in the left hand seems to be releasing, but still got a mild postural position. It holds in a flexation, depends on where it is, or sometimes you can actually go into the quivering. This time it's in the lock position. Oh, darling. You're very brave, very, very brave, my dear. Very, very brave. Oxygen starts at 96, heart rate's at 61. Previous blood pressure earlier today was 104 over 76 minutes. These both all very high for Dyan. She's 85 over that 60, 80 over that 60. So we're seeing higher blood pressure readings for her. And pulse oxygen through, concentrating. Hey baby, it's 5:49. The effects of the midazolam is very fast acting, should be helping. I have no idea. It's okay. It's okay. Tell me what you're trying to say. What's happening? Can you voice what you're trying to say? I think it's almost over. You've got some dystonia in the face. Medications I've given will help relax and will soon disappear, okay? You've got enough oxygen coming in. Yeah. It's nearly there. So you've had some earlier irregular blepharism, so earlier signs of dystonia earlier today. You've also had some lower back spasms, which is why you've been using the hot pack. Syncope current 550. We've had a few occasions of syncope. We've had some irregular speech, mid-cycle speaking, just loss for words. Heart rate is at 50, so it's borderline before alerts and alarms go off. Oxygen threshold's okay, it's 95 and stable with supplementary oxygen. So she's probably struggling a bit with that because oxygen concentration normally bring her up to 98, 99, so she's struggling a little bit getting that in. Current time is 5:51 p.m. It is Monday the 28th. We did a video previously as we're expecting behaviours of activities around 3 to 4 o'clock. That's when we took her BSL. First time we've taken a blood sugar level for a while just to see where things are. Readings are normal 5 for her. Okay, I'm just going to intervene because I can't have you doing that with your CCI. With your neck impingement, if you do that, you'll grind and you're going to hurt yourself. So I'm just supporting very, very lightly the neck to avoid any damage or axial rotation of the neck. CCI, cervical instability, cervical cranial instability. It's okay, syncope again, 5:52. I was concerned previously about her blood pressure and heart rate. Syncope, not also a good indication around that. Heart rate's at 51 at the moment, oxygen saturation at 96. Good feed of oxygen flow coming in. Good respiration rate. Heart rate's at 50, oxygen's at 97. She's still in syncope. It's alright, Bubba. You're doing really well. It's okay, you're safe. You've just been having seizures. We've got you. Of course you can. Chromosome response at 5:53. Still got twitches in the upper torso. Still getting some jerks coming through. Heart rate is at 51 and stable at the moment. Oxygen's 97 and stable, with supplementary oxygen provided 2 litres. Sorry, I need to see what's going on. Alright. Midazolam timer is counting down. We've got about a minute and 30 left. Currently 5:54. How beautiful. Oh, I've got you. Now that you've finished that, put that on. Current room temperature is 25 degrees. So she just get her temperature to see where she's at. You're gorgeous. I'm just going to take your temperature. I just want to see where you're at. So 36.4, so we've brought the temperature down well, which is great. So temperature is low, BSL is low, no issue. Yeah, you look fine, I can tell. Yep, you do. That's your pillow, just put it in place. I've got it. Lay down for me. No, that's a clean one. There's no yuckies in that. That's clean. You're very colour coordinated for today's exercise. Between your Peter Alexander pyjamas, pink beds, sheets.
Everything should be pink.
Hey Google, stop.
Everything should be pink.
Got some good coldness return in response to what I was just talking about 10 minutes after taking midazolam, so she's doing well there. Now, if we get in the conclusion, it's 5:55 of tonic-clonic seizures, then we're going to start looking for the indicators of her yawning. So I normally would expect to see good 2 or 3 very deep yawns around this period of time. That's if the heart rate doesn't play up. 48 and dropping. food in. Non-responsive to stimuli. We're in synco. Hello, Bubba. You're popping in and out of me, literally. Heart rates responded and returned. You were, and then you just passed out, literally. Syncope, and your heart rate just dropped down. Do you have any chest pain at all, Dyan? Before the seizures started?
During.
Okay, during the seizures. Is the chest pain stopped now?
Yeah.
I'm just going to bring you up a little bit. If we have no more tonic-clonic seizures, that'll just help your blood pressure because of obviously having orthostatic intolerance. Dyan's got POTS, postural orthotachycardia syndrome, and orthostatic intolerance. First of the yawns, 557. There's a lot of predictors. These post-tics, vocalised and motor tics. It's okay, Max. Mummy's just clapping. Max is in the sink. I know, don't go there.
Scared him, please.
Yeah, I think your claps may have scared him a little bit. We're just going to straighten your legs out because I don't want you popping a hip out. That's... He's okay. Mad Max, he's fine. I've moved the leg positions because if she does any sudden strong moves, I don't want her popping out either a hip or a knee, which is very susceptible. A lot of patients with 22q can get knee dislocations very easy. Obviously, Dyan is hypermobile. 9 out of 9 when we actually score her mobility at 50 years of age. So Dyan is 50. She's my partner of 34 plus years. I'm also her full-time carer and guardian. Dyan, like I said, has this chromosomal disorder 22q. It's a microdeletion on the long arm of the 22nd chromosome, 30 to 50 genes, 3 million DNA, and up to 180 clinical symptoms come with this condition. 65% of patients do have seizures and seizure-like activity. Get underneath there, good girl. I know. We'll keep the oxygen on you for the moment, miss. Just because, until I see you solidify and have a couple more good yawns.
It smells like the hospital.
It smells like the hospital. Come on, this is your room. We'll spray something nice on it.
It won't work. It's fuzzy.
How about some aromatherapy through the nasal cannula? What do you reckon?
This is what I would have.
Dyan's also very autistic, so sensory things, smell, taste, touch, light.
I reckon I smelled this as a baby.
I'm sure you did. Now, we have actually got a junior size nasal cannula on Dyan. One of the things that we do when we go into hospital, we have great difficulty with a lot of sizing of equipment because a lot of things are adult size, adult hospital. Dyan's not adult size. Most of her things are very small, microcephaly, head size, failure to thrive. What are you trying to say, Boo?
When I was in a humidity group, did I have this?
You may have. But they may have actually been pumping pure oxygen into the humidity crib. You had lung developmental issues because you were born early, weren't you? Yeah, absolutely. Just make sure that we're not crinking. That, we've got an alert. Heart rate dropping, 49, 48. Oxygen flow is fine, that alert's gone. So we've got some good alert indication. Dyan was just having her elbow compressing down on the plastic of the cleaner. That gave me an alert to indicate that there's a problem there. I've worked out that kink. At the same time, your heart decided to drop down. Maybe you weren't getting enough oxygen during that flow. Fun and games, not.
It's over.
Let me have another couple of yawns, miss, and then I'll say yay. It's currently 6 p.m.
I need a hot chocolate.
You need a hot chocolate. I think we all need a hot chocolate right about now, to be honest. It's been one of those shitstorm sort of days. No, I don't think with your dysphagia at the moment, you'll be dribbling out the side. You want to use the cloth? No? Okay. That's alright. Now, nighttime medications were given at 5:15 p.m. normal, so clonazepam 2 milligrams, third sodium valproate tablet for the day. I'd say that her therapeutic levels of sodium valproate are a little bit too low at the moment, not surprising with GI-related tract issues from gastroparesis. She has used some bowel meds today to help get some motility going. As soon as we see normally the second day, and it is the second day, second and third day, they will always contribute to more seizures. It's just a known issue for Dyan. whether that's also part of an electrolyte imbalance, whether it's also part of more pain that gets produced in that process. But they're all key triggers. But she has had a lot of oxygen saturation drops. Randomly. You have today, lots of them. That's why we've had the pulse oximeter on for a long time. We'll download the report from the Check the O2 Max onto the laptop. That way we've got report data for the clinical team. Beautiful.
I'm fine.
Good girl, I'm glad you're fine. Are you fine enough for an ice cream fine?
I'm cold.
Are you cold?
Yeah.
Room temperature is 25.1 degrees. It's 22 degrees outside. You're having a caramel slice. I don't want to tell you this.
No.
Yeah, I ate the last caramel slice. Is that facial palsy there, or are you just frustrated?
Frustrated.
I'm sorry. You do have some neuropathy or imbalance, so it's in the actual right-hand side, it's not equal to the other. That's the second of the major yawn, 602. Like I said, normally 3 good yawn indications tell me that it's the end. And that's really what I expect from the ASM, the anti-seizure medications. We're getting more and more drop-offs of heart rate. That's why the alarms are going off. It's 47 for the heart rate at the moment. Thresholds are set to 50. There are many times when Dyan's heart rate is very low. She's bradycardiac normally, which means a very low heart rate. Those alarms can be annoying, but they're useful to know and draw attention to issues that are going on. You want to stop your oxygen?
Yes.
That's fine. Oxygen, I'm happy with you for stopping. If I don't see a drop off, if I see a drop off, then I will do something about that. Heart rates are still down. Your heart rate's still low. Tics, motor tics, vocalized tics, the Tourette's side of things are quite common post-ictal, sometimes pre-ictal, before and after, mainly after of seizures. A bit like earthquakes, you get the build-up and also aftershocks. This is what the aftershocks look like for Dyan. So she will have some various tics. You might still see some engaging dystonia. So you see the lip sucking, blepharism of the eye. That's still part of the dystonia. Oh, your eyes are wonderful, honey.
What do you mean?
You're putting funny eye faces and deep lip sucking and everything else in between. Lip schmacker.
I want to go on holiday.
Oh, that'd be nice. Let's do that. I want to get away from everything because I'm a little bit sick of everything. People just get me down. They're frustrating and exhausting. Now we are obviously waiting. I've been speaking to 2 different ministers the last couple of days, in the last 48 hours. One is the WA Health Minister, who have requested a face-to-face meeting to deal with what's going on with the overall care of Dyan, a complex patient, centralised to one major Perth hospital where we can't get the care that we actually need because there are no adult specialists for 22Q in Perth. There are Children's Hospital, Perth Children's Hospital, one in Queensland, have specialists, but we can't access them when you're an adult. Can't go backwards, so it doesn't really help much, does it? I've also engaged at 7 o'clock this morning with the NDIS Minister's Office because of the change in circumstances. We desperately need to get change of circumstances to access more funding for Dyan. So that's been escalated along with complaints escalation inside the NDIS path of general inquiries, a letter from the support coordinator. And I've also engaged with the Office of Senator Jordan Steele-Johns, the Greens MP, to also assist if it's possible to help with the escalation. I'll put this to the side. We have over here a caddy which is full of all the medical things that we need during any sort of emergency. They're always available to us. What's with your hands, Boo Boo?
Well organised.
Yeah, you are very super organised and colour coordinated, aren't you?
These are rough.
Your band-aids are rough?
Yeah.
Would you like me to take your band-aids off?
It
You
might
can't yet?
bleed. I
You
don't
might
want
bleed?
To see blood. I don't like blood.
Nobody likes blood. No one wants to see that. Can I just have a look inside your mouth, please? Good girl. We've got a new, couple of ulcers. Right hand side high, left hand side mid and forward. So there's been a couple of bite actions during the seizures, tonic-clonic seizures and dystonia. They're not actively bleeding, but they're open cuts. We need to manage those as well. Luckily, the mouth heals very quickly. Have you got any nausea?
No, I don't.
I'm going to bring your bed up to you. Just as long as you promise not to sink up and pass out, because I don't want to have you fall over and whack your head. We're just going to place this over here for the moment, just in case you do anything silly.
It's really cold in here.
Alright, well, let's actually deactivate the aircon. How about that?
Yes,
Aircon off.
please.
That's over there for you.
Fine.
Room temperature is actually 25.2. We monitor all this just to see what variables affect Dyan. A bit like taking the piss. She's fine. She's fine. Clearly she's fine, aren't she, darling? Right, what day is it?
Monday.
Well done. What is 7 times 2? Well done, you. Now, just a couple of things with the face. Third of the yawn, 6:07 p.m. I think we're over the tonic-clonics. Just give me a big, big smile for me. I love seeing your smile. Thank you. Now poke your tongue out as if you're going bleh. Well done. Show me your shock and scary face. Go. Bleh. Come on. I know, dribbler.
What?
Shock face.
I don't know, shot.
Eyebrows. Good girl. And relax. Very good facial expressions. We've got mostly full range of motion and it's equal on both sides. I do certain tests post seizures just to make sure that we haven't lost any function. There can be sometimes neuropathy, facial neuropathy particularly, where certain parts like a Bell's palsy aren't functioning. Sometimes we can get paresis.
Like today, my eyelid just dropped. My eyelid just dropped down here.
I know, right?
It was like,
And you couldn't tell because you're looking outwards through it,
I didn't
unless
know.
you actually looked at a
I
mirror.
didn't know. You said to me your eyebrows are uneven.
Yeah,
I'm
and your
like,
eye
what?
is almost closed.
And I'm like,
61
whatever.
heart rate, 94%
I
oxygen, off supplementing oxygen. Your oxygen is a little bit
I
low.
can see, you know, so it's like, I'm like, whatever. I look in the mirror, my eyes done it.
It's a bit scary, isn't it, for you?
It's creepy.
It is a bit creepy, isn't it, when you've got no control of your body. We have got oxygen still flapping a little bit. I'm just keeping an eye on Dyan's oxygen stats through here at the moment, because now that she's off the supplemental oxygen, we just want to make sure that she is breathing and getting enough in. Vocalized tick, physical tick, all part of the tourettes activities. You can see some of the facial grimaces and things that are going on. And sounds.
I should have HJs.
You should have hungry jacks, should you? I wouldn't mind that either.
They do frozen Coke.
I don't know if they do. Does HJ? I know McDonald's does frozen Coke.
I only like frozen Coke from Macca's.
Yes.
But I want HJs.
That's a conundrum, isn't it?
I don't know how to resolve that problem.
Well, we get the frozen drink from Macca's and then go through the drive-through of HJ's.
They should just cooperate together.
They should. They're only the next block apart. They should talk to each
But
other.
it's all competition.
It is actually.
Life is one big competition. I'm not in it.
To
I'm
win it?
out.
You're outside
I'm
of the
not
competition.
in a competition.
No. What is this? Hunger Games? The competition?
I just want to be kind.
Be nice.
I can't deal. All I can offer you as well is kindness.
Kindness is what we should all offer each other anyway, darling. It's the most important thing.
I can't do those other things. I haven't got my abilities
No,
anymore.
that's okay. I need you to relax now. Current time is 6:11 p.m. This is Monday the 28th of April.
I'm going to be okay.
She's going to be okay. We've had the 3 sets of yawns. Make it 4th one. I'm happy with that.
I think I should have HJs, but Mac is frozen Coke.
Well, I'll see what we can do to work on that one. Now, obviously, with no support staff available, Dyan can't be left alone in this state. We've already had other dystonic activities. Oxygen drops and heart rate spikes and drops as well. There are a lot of conundrums going on here simultaneously.
Conundrums. The word of
Conundrums.
the week, everybody.
Indeed.
Conundrums.
Conundrums, indeed. Well, guys, thank you for being here and watching through the episode, keeping eyes on Dyan.
I can't
It's very
get
helpful to
awake.
us.
I feel really tired.
Oh, I feel very tired as well.
Annoying.
Dyan woke up at 6 o'clock this morning after only getting to sleep at 2 o'clock. A lot of stress is going on. So 4 hours sleep is the primary driver towards seizures.
I'm having like all of these problems in every avenue.
Yep.
And stacking
no one is
up,
settling anything
stacking
down.
up,
And just when you think it,
nothing's being resolved.
no.
It's just
In fact, it's
going
just more and
in
more,
circles.
more and more things being added to the mix, isn't it?
I feel worthless because I
I'm sorry.
can't make people happy. Obviously, I'm not good enough.
I think we have to make
For
ourselves happy,
them.
because if people aren't accepting you for who you are, then it's not good enough
Like
by
I
my
try
standards.
to be good enough, but
Yeah.
obviously I'm
It's okay.
not.
Relax. Okay, you're doing okay. The people out there in YouTube get it, because a lot of the people out here are people with complex, chronic, long-term conditions, or also genetic conditions. So a lot of our subscribers, our follower base, absolutely do get it. Give Dyan a big thumbs up of encouragement. Thank you for everybody's interactions on the channel through the comments. We really do appreciate that. Now remember, we're not medical professionals to give you specific information. We're not here to diagnose you. That's what your own primary care physician or specialist is for, so please go see them if you need to. You're going to scratch your throat of dysphagia? Okay. A bit of aspiration maybe?
No.
No?
Just I've got a sore throat for a few days.
Yeah. You're going to have sore gums now with the bleeding on the
It's
inside.
really hurting. I got all the feelings
Yeah.
already.
Your shoulder, right shoulder, popped out a little bit during and popped back in.
No.
So I'm hoping it feels okay for you now.
How bad?
It's okay, it just popped. Luckily, you were out of it at the time,
Like
so I'm
the
glad.
sublux half or mine?
I would say half sublux, so it wasn't a full dislocation. No, that's, if it's in, it's good, we hope. If you have got comments, questions, ideas and suggestions, please do leave them below. Don't forget to subscribe and hit that notification bell. And of course, if you can help us by sharing the channel to increase the reach, so that we can help to educate and advocate about Dyan's condition. You can see the hard work that she puts into this, and it's worthwhile letting other people know about 22q and also rare genetic conditions as well.
I've been trying to do better videos, guys.
We have some fun videos.
I'm sorry.
We have been through long weekends of stress, and it hasn't been fun.
I've got some science
You have got some science
to do. There's the fun stuff, and it's gonna be cool. It's gonna be really cool.
You'll see there's an imbalance with the right eye. The eyelids are struggling to open.
Hang in there for me, because I'm going to also I'm going to visit some nature places, and I'm going to hopefully go to Whiteman Park.
Yeah.
And hopefully
See some animals.
Elizabeth Key.
Okay, we've got some things
Show
planned.
you my city.
All right, well, stay tuned. So make sure you have subscribed so you can see what goes on next. But for now, we're going to relax you, unwind, let the medications kick in. I'm going to give you some more meds and check you over.
No more meds.
Well, we'll see. But I have to double check your body. And when we do fish seizures, I have to check, make sure that there's no bruising, contusions, avulsions, make sure joints are back in, and help with that little bit of traction and massage. Thanks for watching, guys. We'll see you soon. Bye for now.